looked at our whole process of efficiency in bringing cataract patients in. You know, the surgeries themselves are typically fairly quick, and there's more time spent non-operating than operating. And in order to try to make it more efficient for us, make it a better experience for patients, reduce their waiting times, we thought of what could we do that we do here that they could do just as well. And the biggest thing was getting them dilated before they came in.
Well, as far as time and what it takes to get it to implement it is relatively simple. It's not, out of all the things that we do in a day, it's probably one of the easiest things to do to make your day easier.
You know, our staff embraced this because they just saw it as a positive win-win situation, and once we started it became obvious that's what it was.
We just, during a meeting, explained to them what our needs are, and we need to get them dilated sooner, and this is what the doctors have chosen to do, and the instructions, and went from there.
We've really not had any resistance from patients doing it. It's part of their pre-operative routine that we go over, my surgery counselors do with them when they're booking their surgery.
The surgery counselor goes over the whole package with them, discusses all the drops. They show them a chart. The patient gets to choose which package they want to do. Do they want to purchase the drops from us? Do they want to have the e-script done? Some patients have insurance. It's required. They get things from their insurance company through mail order. So they make that choice. That's done. The surgery counselor reviews it. The patient has an opportunity to ask questions at that time to make sure that their understanding is good.
And it's re-emphasized usually a day or two before when they get a call to go over their times to come in, and they'll emphasize that again, the dilation and any other drops we're using.
One of our drops, the Cyclogel, has a red top on it, so that's very easy to distinguish from the other drop. So overall, it's pretty easy for the patients.
They take one drop when they get up in the morning, one drop before they leave for their appointment. And so then they're usually dilated pretty well. Some of the glaucoma patients are a little bit more difficult to dilate, but for the most part, a high percentage are dilated well when they come in.
Once I get the patient into the OR, prep them for the doctor, if the eye's well dilated, the surgery goes easier. It's less steps the surgeon has to do.
The only problem we've occasionally seen is that because they have some dilating drops, sometimes they'll, especially after the first eye's been done, they'll sometimes mix that dilating drop up, mix up that dilating drop and put it in their other eye that's already been operated on. Sometimes they come in the next day and both eyes are dilated. So, but that's really a minor thing, and it's very few patients that it occurs in.
It's just an easy process. It's easy to implement. The patients are receptive. They understand that it's going to help their surgery, be a little quicker, get them in and out a little quicker. So I think it's a good process to implement.
I think the two most important things to patients are that that they have a good surgical result and that they had a good experience overall, which includes how long did they wait in the office, how long did they wait in the surgery center, how well were things explained to them by all the different staff members they interacted with. And this is just a part of that whole experience to make it an easier experience.
Out of all the things we try, it's probably one of the easier things to try or to do.
Just do it. Just do it. You'll be happy that you did it.